During the activation of myocardium, electrical impulses or action potential are propagated in the various directions. These electrical forces can be picked up from the surface of the body by means of an electrode and recorded in the form of ECG or an electrocardiograph. Now, ECG as a non-invasive yet most valuable diagnostic tool. A pair of electrodes that consisting of positive and negative electrodes constitutes an electrocardiographic lead. Now, each of these lead is oriented to record electrical forces as viewed from one aspect of the heart. So, the position of these electrodes can be changed so that the different leads are obtained. The angle of electrical activity recorded changes with each lead. Several angles of recording provide a detailed perspective of the heart. The 12-lead ECG records a complete picture of the heart's electrical activity in a 12 different perspectives. These 12 views are collected by placing in electrodes on wrist and ankles called as the limb leads and chest called as the precordial leads. Then these electrodes are connected to ECG machine or the monitor that registers the heart electrical activity. There are 10 electrodes providing 12 perspectives of the heart activity using the different angles through two electrical planes, vertical and the horizontal planes. Now, limb leads. These are the leads derived from the electrodes placed on limbs. An electrode is placed on each of 4 limbs, namely right arm, right leg and the left leg. Keep in mind that right leg is neutral, also known as point 0, or it acts as a grounding electrode. There are 6 limb leads which are derived from placing 4 electrodes in each of the limbs. Why there are 6 frontal leads when we have just 4 limb electrodes, which we will discuss when we discuss Enthovian triangle. Now this limb lead is again divided into 3 standard limb lead and 3 augmented limb leads. Standard limb leads obtain a graph of electrical impulse as recorded between 2 limbs at a time. Therefore, the standard limb leads are also called as bipolar leads. In this lead, one limb carries a positive electrode, another carries a negative. There are 3 standard limb leads, lead 1, 2 and 3. Now, this lead 1 is formed from the electrode placed on left arm, right arm and the left leg. In this particular lead, left leg acts as a grounding electrode. The waveforms which are formed in this lead are positive. Now, lead 2. This lead is formed from electrodes placed on left leg, right arm and the left arm. Left arm acts as a grounding electrodes in this particular lead. The waveforms which are formed in this lead are positive. Now lead 3. These lead formed from the electrodes placed on left leg, left arm and the right arm. Right arm acts as a grounding electrode in this particular lead. The waveforms which are obtained in this lead is positive or the biphasic. Now, augmented limb leads obtain a graph of electrical forces as recorded from one limb at a time. Therefore, the augmented limb lead are also called as unipolar leads. In this lead, one limb carries a positive electrode while a central terminal represents the negative pole, which is actually at a zero potential. Or simply, it uses one positive electrode and the reference point is calculated by ECG machine. There are 3 augmented limb leads. AVR, which means augmented vector right, which represents the positive electrode is on the right shoulder. And AVL, means augmented vector left, which represents the positive electrode is on the left shoulder. And finally, AVF, which represents augmented vector foot, positive electrode is on left foot. Now lead AVR, positive electrode placed on the right arm and the waveforms have the negative deflection in this lead. Now lead AVL. positive electrode placed on the left arm, waveforms have positive deflection. And finally, lead AVF. Positive electrode located on left leg, waveforms have positive deflection. Now, chest leads. Chest leads are obtained from the electrode placed on the precordium in the designated areas. An electrode can be placed on 6 different positions on the left side of the chest. Each position represents one lead. Accordingly, there are 6 chest leads. They are: lead V1. This electrode is placed on 4th intercostal space just to the right of the sternal border. And lead V2. This electrode is placed on the 4th intercostal space just to the left sternal border. And lead V4 is placed over the 5th intercostal space in the mid-clavicular line. And lead V3, which is placed over the point midway between the V2 and the V4. Next, lead V5. This electrode is placed on anterior axillary line at the same level as lead V4. Next, lead V6. This electrode is placed on mid-axillary line at the same level as lead V4 and lead V5. Chest leads records the potential transmitted onto the horizontal plane, hence it's also called as transverse lead. Sometimes the precordial leads are obtained from the electrode placed on the right side of the chest, and it is useful in the cases of true mirror image called as a dextrocardia and in acute inferior wall MI to diagnose right ventricular infarction. Now, problems in the specific leads or the group of lead suggest that there might be a specific region of the heart that are affected. Now, for an instance, let's take an example of most common coronary arteries which are involved in myocardial infarction secondary to atherosclerosis as a most common cause. Left anterior descending artery, left circumflex artery and right coronary artery. Now, let's look at the lead which are parallelly associated with these arteries supplying the myocardium or to the heart. Now, the right coronary artery supplied the region in the myocardium can be represented in the ECG as a inferior leads. They are leads 2, 3 and AVF. Next, left circumflex artery. The region which is supplied by left circumflex artery in the myocardium can be represented in the ECG as a lateral leads. Lead 1 and AVL and V5 V6 represents the lateral lead. Now the region which is supplied by left anterior descending artery or septum and anterior wall of myocardium. It can be represented in the ECG as a V1 V2 which is indicating a septal leads and V3 V4 which is indicating an anterior wall of myocardium. Ischemia secondary to atherosclerosis in any of these 3 major arteries can be seen on ECG as a specific changes in a particular lead or in the group of leads.